is anxiety? Anxiety is a feeling of uncomfortable, such as worries or fear, that can be mild or severe. Everyone has feeling of anxiety at some point in their life. Anxiety is your body's natural response to stress. It's a feeling of fear or apprehension about what's to come. For example, you may feel worried and anxious about sitting an exam, having a medical test, job interview, or the first day of school. Giving a speech, that may cause most people to feel fearful and nervous. And general anxiety is one of several affective factors which can influence attention and hence lead to a deterioration in language performance. But there are also specific types of anxiety related to language which reflect the complexity or perceived importance of a language task and the extent to which the task place a premium on accuracy. An additional factor might be the individual's uncertainty about their ability to perform the task. This might result from introvert personality traits, from a lack of self-confidence, or from awareness or limitation in a particular language skill area. Anxiety manifests itself in speech in a greater degree of pausing and a lack of coherence in the insertion of fillers such as and in an increased number of false starts. This suggests that the planning function is a fact. In the case of a foreign language learner, anxiety may sometimes lead to greater accuracy as heightened attention is paid to form, but fluency may suffer as a consequence. But if your feelings of anxiety are extreme, last for longer than 6 months, and are interfering with your life, you may have an anxiety disorder. What are anxiety disorder? It's normal to feel anxious about moving to a new place, starting a new job, or taking a test. This type of anxiety is unpleasant, but it may motivate you to work harder and to do a better job. Ordinary anxiety is a feeling that comes and goes, but doesn't interfere with your everyday life. In the case of an anxiety disorder, the feeling of fear may be with you all the time. It is intense and sometimes debilitating. Specific phobias are also included in the types of anxiety disorder. This condition is an excessive and persistent fear of a particular object, situation, or activity that is generally harmless. For example, odontophobia, spider phobia, hay phobia, cockroach phobia, and so on. This type of anxiety may cause you to stop doing things you enjoy. In extreme case, it may prevent you from entering an elevator, crossing the street, or even leaving your home. If left untreated, the anxiety will keep getting worse. Anxiety disorder are the most common form of emotional disorder and can affect anyone at any age. According to the American Psychiatric Association, women are more likely than men to be diagnosed with an anxiety disorder. And what are the types of anxiety disorders? Anxiety is a key part of several different disorders. These include panic disorder. Panic disorder is experiencing recurring panic attacks at unexpected times. A person with panic disorder may live in fear of the next panic attack. And the second one is phobia. Phobia is excessive fear of a specific object, situation, or activity. Social anxiety disorder, extreme fear of being judged by others in social situation, obsessive compulsive. And the second one is compulsive disorder, recurring irritation, thought that lead you to perform specific repeat behaviors aberration. And the next is anxiety disorder, fear of being away from harm or loved ones. Illness anxiety disorder. The next is anxiety disorder. Anxiety about your health, formerly called hypochondria, post-traumatic stress disorder, or PTSD. Anxiety following a traumatic event. Defining anxiety, Brown defined that anxiety is associated with feeling of uncomfortable frustration, self-doubt, apprehension, or worry. According to Joyce while anxiety is accompanied by muscular tension such as a feeling of discomfort in the stomach or the clenching of the jaw, anxiety is the subjective feeling. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.